Welcome to the Organ and Tissue Donation Overview, presented by the Washington Regional Transplant Community. Today's objectives. We're going to introduce you to the Washington Regional Transplant Community, also known as WRTC. We're also going to provide you information about the donation process at your hospital. And lastly, we're going to provide you information on what your specific role is within this donation process. WRTC is responsible for the recovery and allocation of donated organs, eyes, and tissues for transplant and research in our service area. We also work very much like a hospital. We provide on-call donation services 24 hours a day, 7 days a week, and 365 days a year. You can call us at any time. And our number one mission is to increase the number of people who say yes to organ donation so that we can save more lives through donation and transplantation. Here's a map of our donation service area. WRTC covers the entire District of Columbia. We cover Northern Virginia and 3 Southern Maryland counties. WRTC is a nonprofit organization. We are also known as an OPO, an Organ Procurement Organization. We have been federally designated to serve the DC metro area. We work directly with 45 hospitals in our area, including yours, as well as 6 transplant centers, all listed here on this slide. So why is WRTC here? Currently, there are about 112,000 patients in the U.S. waiting for a life-saving organ transplant. About 2,400 of those live within our community. These are kids that go to our schools, members of our churches, or even colleagues in our workplaces. Sadly, 17 to 20 people die every single day waiting for a life-saving transplant. These are all lives that can be saved if we simply had more organs available. And every 10 minutes, a new patient is added to the national transplant waiting list. Although we really have been increasing the number of transplants in the U.S. year after year for the past 5 years, it's really hard to keep up with this number. WRTC works very closely with the United Network for Organ Sharing, UNOS. They are a national organization located in Richmond, Virginia, and they maintain the registry of all patients waiting for a life-saving organ transplant in the U.S. They also help establish a system that makes donation and transplantation available to everybody, regardless of their race, regardless of their age, their gender, political status, social status, or whatever it may be. All of these rules and regulations get updated regularly due to medical advances and other factors to ensure fairness. Now we're going to look at the organ allocation criteria. Who gets the organ and why? Organs are allocated based on the following criteria. Medical match, meaning the blood type, the height, and the weight. We also look at the medical urgency, how sick is the patient. And we also look at the time accrued on the waiting list. How long has a patient been waiting on the list? There are several laws and policies that govern donation. For instance, in 1984, the National Organ Transplant Act made it illegal in the U.S. to buy, sell, trade, or barter for organs for transplant. In 1972, the Uniform Anatomical Gift Act made it legal for people to donate his or her organs upon death. It is important for you to know that donor designation on a driver's license is considered a legal document, as it is first-person consent, and WRTC is legally and ethically required to fulfill the individual's decision to become a donor. We also have policies in place with all hospitals to ensure that we have a process in place to honor donation wishes. Did you know your hospital has a policy to provide the option of donation to families? Hospital conditions of participation with WRTC include: hospital staff must call WRTC on every death or imminent death of a patient. Hospitals must ensure that the family of every medical suitable donor is informed by WRTC staff of their option to donate. Now we're going to begin to cover the pathways for organ donation. The last one here is living donation. You can become a living kidney or living liver donor if you would like to do that. But the ones that are related to deceased patients are the first two, the brain dead donor and DCD, the donation after circulatory death. Before we begin to cover the organ donation process, I just wanted to show you the organs that are available for donation. You can donate your heart, your lungs, your liver, your kidneys, your pancreas, and your small intestine. So one single donor can save up to 8 lives. But sometimes the liver is able to be split into two for two different recipients, one pediatric and one adult. So in reality, you can save up to 9 lives through organ donation. Did you know that organ donation is a very rare opportunity? Less than 1% of all hospital deaths are of patients who die in a way that allows them to become organ donors. All potential organ donors must be on a ventilator upon death. These are the required imminent death referrals that you guys make to WRTC as part of the donation process at your hospital. And WRTC will screen each referred patient for the potential of organ donation. Now we're going to begin to cover the required referral call to WRTC for organ donation evaluation. This is one of the more important slides in the presentation, as it will help you identify potential organ donors. If you received a small bag today, you will find a small white plastic card we call trigger cards that you can attach to your ID badge. This card will give you the information you need to make the referral calls. If you ever have a ventilated patient on your unit that meets any one or more of these clinical triggers, please call WRTC to make the referral. I'm going to go down the list. Before there's a discussion of withdrawal from life-sustaining support, you have to call WRTC before you have that conversation with the family. If the family ever makes them a DNR or decelerates their care, please call WRTC. If the patient ever reaches a GCS 5 or less without sedation, call WRTC. If there's brain death testing being considered or actively pursued, also call WRTC. And lastly, if the family mentions donation. If the family mentions donation, you can say something along the lines of someone from end of life care will come and speak to you. Call WRTC and we'll contact the family shortly after. Remember, WRTC is a resource for you. After you have made the initial referral call to WRTC, we will take basic information to determine organ donation suitability. But whenever WRTC comes on site to the hospital, we will speak with hospital staff and evaluate the referred patient as a potential organ donor. We stay in the background and don't approach the family. Depending on the progression of the case, you'll see anywhere from 1 to 2 individuals from WRTC. And whenever WRTC staff is on site, we will request to huddle with specific hospital staff members related to this case to ensure everybody is on the same page and answer any questions that you may have. During these huddles, we'll review family dynamics. We'll see who the legal next of kin is. We'll check hemodynamic status for that patient. We'll discuss brain death testing or withdrawal of support plans. And WRTC will also let you know about our approach plans to the family. Our goal is to be ready to discuss donation when the family is ready. So when does WRTC approach the family about donation? WRTC talks to families after they have accepted the death or imminent death of their loved one. We want to make sure the family understands that everything has been done to medically treat their loved one and there is no conflict of interest. We approach families at the hospital after the hospital staff has notified them their loved one is brain dead, or after the family has made the compassionate decision to withdraw the ventilator and all life-sustaining treatment because there are no other treatment options. WRTC staff are highly trained to talk with families during this very difficult period of time. They're very sensitive to the religious and cultural diversity represented in our community. We ask hospital staff to refrain from bringing up donation to the family, as they may perceive it as a conflict of interest. They see you going in and out of that room doing everything you can to help their loved one. If you bring up donation, they can and sometimes will assume that you are only caring for their organs now. We are now going to cover donation after brain death. Brain dead donors suffer irreversible cessation of the brain and brainstem functions. Almost 2/3 of all potential organ donors are from anoxic injuries, such as stroke, heart attack, and drug overdoses. Hospital staff will determine and declare brain death after a series of bedside clinical exams that test the loss of all brainstem reflexes and the loss of the respiratory drive. Families have a very hard time understanding brain death. It is difficult for the family to comprehend and accept the death of their loved one because the ventilator makes it look like the patient is still breathing. The monitor is still going, and their skin is still warm. WRTC hosts regular donation specialist trainings that offer up to 7.5 free CEs, where we cover the entire donation process, and we highly encourage everyone who is interested in learning more to attend. We host these regularly at our office or at different hospitals. What if a patient does not meet brain death criteria? Maybe this patient had minimal corneal response to light in one eye, or has taken one or two breaths during the apnea test. Do you think this patient can still become an organ donor? The answer is yes, possibly. Patients who do not meet brain death criteria may still be considered for organ donation after circulatory death, also known as DCD. There are three important criteria that must be met for patients being considered for this donation pathway. First, patient's illness or injury caused an unrecoverable neurological or physiological devastation, resulting in ventilator dependency. Second, family has decided to withdraw mechanical ventilation and stop life-sustaining support for their loved one. And lastly, upon WRTC evaluation and consult with the attending physician, the patient is expected to die within 90 minutes following the withdrawal of all support. As with all organ donor cases, WRTC has staff assigned to help make the donation process go as smoothly as possible for the donor family members as well as the hospital staff. We've now covered the entire organ donation process. We're going to switch gears here a little bit and we're going to begin to talk about tissue donation. 99% of patients who die in a way that allows for tissue donation. It's the complete opposite of organ donation. So almost everybody can become a tissue donor. Nationally, each year, approximately 39,000 tissue donors provide life-enhancing tissues for transplant. Due to this generosity, nationally, about 1.75 million tissue transplants are performed every single year. Tissue donation is highly regulated by the FDA. FDA considers tissue transplant a medical device and have strict regulations to follow to ensure the supply of tissue is safe from any diseases to be transmitted. Each tissue donor is treated with respect and dignity. Highly trained tissue recovery technicians always reconstruct the body after recovery, so an open casket funeral is always an option for the families. The technicians even do this when the family decides to cremate their loved one, just in case they change their mind later. Here's just a list of the tissues that you can donate. You can donate your heart valves, pericardium. Donated corneas can restore sight to 2 patients. It is one of the most common tissue transplants, and it's done at a very high rate of success. Donated bone can restore an arm or leg damaged by cancer, trauma, or infection that would otherwise be amputated. Recovered bone can also be shaped into specific sizes for orthopedic surgeries or processed into a powdery paste for dental procedures. Skin can help burn victims regulate their body's temperature, prevent infection, retain moisture, and promote healing. Donated tendons and ligaments can be used to rebuild damaged joints due to trauma or disease, and donated saphenous veins can replace damaged vessels in diabetic patients to restore blood flow, or it can be used for coronary artery bypass heart surgery. So as you can see, tissues are considered to be life-enhancing, but they can also be life-saving in a lot of cases. The required referral call to WRTC for tissue donation evaluation is very simple to remember. You must report every patient death within 60 minutes to allow us to medically screen each patient as a potential tissue donor. The call center will collect patients' demographic information, admit and diagnosis, brief admission course, and past medical history if available. We ask you to please get the next of kin's phone number and where they will be for the next 24 hours in case we pursue this patient as a potential tissue donor. The donation process doesn't end when the organs are recovered and transplanted, as WRTC continues to stay in touch and provide support to every donor family. Families will receive a letter from WRTC providing general outcome information unless the family requested not to receive this information. WRTC has 2 wonderful donor family advocates, Lisa and Marie, who provide various bereavement services to families. We also provide Remember for Life memorials to donor family members to share at the funeral or other gatherings. These Remember for Life memorials include a display frame to inform everyone their loved one was a donor, a basket including Donate Life bracelets, pamphlets, and other information supporting donation. So finally, to review your role in the donation process, please remember that you are going to call WRTC on every patient death within 60 minutes. You're also going to call on every patient ventilated who is on the path of imminent death, as long as they meet one or more of the clinical triggers found on the trigger card. And we ask you again, please do not mention donation to the family. WRTC will work with you to approach the family at the appropriate time and in the right setting. Here are some of the common questions and concerns we hear from folks out in the community. Please take a moment to read through the questions and the answers so you can become familiar with them and help us debunk some of these myths and misconceptions with your family, friends, or in your workplace. I'd like to thank you for your time and attention. Thank you.